decided to do this. The reason why I decided to put this on, a couple of weeks ago I contacted Lisa, and I asked her to come out specifically, and there's a reason for this. I wanted to get us in Villa Park and get this out on tape in our community, to get us out on the lead, because you know the mosquitoes haven't been as bad, but they will be by come fall time. You know how that'll be. They'll breed and they'll come out in the cooler air, and we'll see them, or even in the hot air. But everybody's got concerns about the West Nile virus, so I've invited Lisa Hayes from the DuPage County Health Department to come in here and give us a presentation on the West Nile virus. She is a health promotion specialist with the DuPage County Health Department. She's been there for 20 years, and so she's got the tenure that I have. we both got that down, but you don't have 26 years, so
no. But I'll be 21 at the end of this year.
She'll be 21 years old at the end of this year.
Yes.
Anyways, so Lisa's gonna give us a nice presentation about the West Nile virus.
Yeah. Good morning. How's everybody today?
Good.
Good. Okay. Well, as you know, I'm here to talk about West Nile virus. The program that we have established in DuPage County is called Fight the Bite. You can get more information besides what I'm going to tell you today on our website, which is www.dupagehealth.org, and you can go under environmental health, and you can go into the West Nile virus tab that we have, and you can get a lot more information as well besides the information that I'm going to give you today. I did bring a PowerPoint presentation on. I gave one to everybody. If you want to follow me on it, you can. If you just want to listen to what I have to say, that's fine too. But I know some people like to actually have a visual and follow as one is talking. So first of all, what is West Nile virus? West Nile virus is a seasonal health threat that's transmitted by an infected mosquito that flares up pretty much in the summer, and it goes through fall, okay? There's no medications and no vaccines for the West Nile virus, just so everybody knows. The type of mosquito that spreads West Nile is called the Culex pipiens, which breeds in stagnant water during the hot weather, which we already have, which is usually July and August, and usually after it rains. And actually, this is what we've been having right now: rain and a lot of heat. So this is the time of year for the West Nile. Okay. The Culex pipien is very hard to distinguish from all the other mosquitoes. The only way you could really determine that type of mosquito is really looking under a magnifying glass to actually see the difference between a regular mosquito and this typical mosquito that spreads West Nile. Okay. What are the symptoms of West Nile virus? Well, approximately 80% of the people don't get any type of symptom at all, okay, with West Nile. And that's a big chunk, 80%. So that's a good thing, that 80% does. The other 20% that does end up having West Nile virus is a very mild case, okay, which might cause a headache, you might have fever, you might have a different type of symptom that you normally wouldn't have, okay. There is 1% though of people that can get West Nile virus, and these are people that have cancer, might be diabetic, might have heart problems. Those are the people that might get West Nile virus because their immune system is very low. Okay, so that's why I'm here today to tell you about West Nile virus, because the age group that is most at risk are people over 50. And believe it or not, I'm part of your group because I am over 50. So I'm also at risk to get West Nile virus. And it's very important that you all know how to protect yourself against West Nile virus now that we are in the summer months of this year. So what can you do to prevent West Nile virus? Wear mosquito repellent. Okay. If you don't like wearing it on your body, you can put it over your clothes. Okay. and be sure you wear mosquito repellent. When is a good time to wear mosquito repellent? Well, when you're out, some of you are gardening, you might want to be wearing that when you're out gardening. But the high times are dawn to dusk, okay? And if you see on the last page of the presentation, they have written down what we can do. First of all, it says drain items that collect standing water around your home. Some of you might have a little pool. If you have a little pet and you like having your dog outside, you want to be sure that you are always draining that water. You don't want to leave it there for days. Flower pots. You know, some of us have that rim under our flower pot, and we tend to forget that water sits in there, even though we're watering our plants, but it's staying still. So you can, West Nile can produce around those flower pots. Okay. So in DuPage County, we call it the 4 Ds: drain, defend, dress, and dawn to dusk. Defend, I said, wear insect repellent, and it should contain the word DEET. So when you read the can or the cream that you are going to put on, be sure it has the ingredient of DEET, and that DEET. Okay, that's very important to have on. In the early morning or late evening, if you're outside at a picnic or walking around early in the morning, be sure to wear long sleeves. Okay, that's another way to help prevent West Nile virus. Long sleeves, long slacks, maybe not wear sandals, wear gym shoes, be sure your feet are covered as well, because if you're wearing sandals, you can still get bit by a mosquito. So when you're outside, be sure you are wearing that type of clothing. Obviously, if it's really hot, you're not going to be covered completely, but use your best judgment. And once again, dawn to dusk, wear repellent if you're outdoors during the prime times of activity. Okay, picnics, I know this is the time where we're going to be out a lot. Some of us like to go walking early in the morning. Be sure that you have your insect repellent, because mosquitoes are around all the time. It's hard to avoid them. But obviously they come out more in early morning and at dusk. Okay? So does anybody have any questions regarding the West Nile virus? No one has a question?
How do you know you get it? I mean, how do you know when you got it?
Well, 80% of the people show no symptoms. So somebody might have gotten bit by a West Nile mosquito. You might not even know it, because if you do have a symptom, it could be fever or a headache. But remember, 80% of the people don't have any kind of symptom with West Nile. And like I said, there's no vaccine. Hopefully, maybe one day in the future, there will be a vaccine for West Nile. But right now, there is no vaccine for West Nile. So if you are a person that has a chronic illness, those people are at higher risk because their immune system is not as strong as somebody that's fine. So those are the people that really have the possibility of getting West Nile, are the ones that are, chronically, consistently ill all the time. And right now in DuPage County, we have not had any cases of West Nile virus up to date. Last year, we had 5 deaths in DuPage County, and that's why we are bringing it out this year to everybody, so everybody is aware at least what to do when they are out in the community. Obviously, don't curtail your life differently just because of the little mosquito, but you want to be sure you know what to do when you are out there in the community. Yes, sir?
Yeah, you talk about the 5 deaths. Were those people actually sick to start with?
Yes.
And this just made it worse?
Correct. Those were,
I mean,
everyone
this
had.
isn't like you're going to catch some terminal disease just
No,
because
sir.
the mosquito bit you.
Right. Those people that died,
Were sick to
they
start
were
with.
sick to start with. Some of them, I think there was 1 or 2 that did not even know that they had some illness, and actually found out, once they were diagnosed with West Nile. But yes, it was because they had a chronic illness.
And what was responsible for the death, the West Nile virus or the chronic illness?
Well, they were saying it was the West Nile virus, but of course the chronic illness has something to do with it, because your immune system, it cannot defend your body, and your immune is low, so the West Nile took over.
But once you get, if you were to get the West Nile virus, does your body then become immune to it naturally after a while, or defend against it, or how does that work? Or are you always you always carry the virus from that?
Are you always potentially gonna get it again?
Well, that's a good question. That's the first time I've heard that one, but I would have to get back to you on that.
Okay.
That way you can let everybody else hear the
Yes.
answer of that question. Because I don't know if your body's immune to it.
Yeah. I don't know.
That's a good question,
I
though.
mean, I was wondering if it was like the cold, if, you know, you get the cold again, but once you get the cold, your body defeats the cold in a sense, and you can get it again, but maybe it's a situation like that, but that's what I'm wondering.
Right, but if you're in that 80% that you might have symptoms of fever and headache, you might not even know if it's related to West Nile virus. You might just be feeling
Exactly.
that way for something else. So that's why it says 80% really show no symptoms.
Right.
And those 20 that do are the fever, the headache.
Is there a test that you can take if someone
For a
suspects that they have West Nile virus, or how do they?
For humans,
Yes.
there is a test, obviously, once you get to the hospital, and they have to run several tests to find out if it's West Nile, to be sure.
And then what do they do for treating, do you know? offhand?
That I'm not certain. I guess every case would be different, depending how severe, if you came in right away when the symptoms just started, or did you wait weeks and now, you know, it's really, time has passed. So it depends on every individual as far as, you know, preventing, you know, if you're gonna take care of going to the doctor right away because you have these symptoms, or you're just gonna let it go.
Now, you mentioned the 5 extreme cases last year. How many reported cases do you know offhand around, about number?
I don't know how many cases were reported offhand. I just know of the 5 deaths that we had, but I do believe we did have a good number, but I couldn't tell you exactly what that number was. But I can also get back to you on that specific number so you can let everybody know.
But it's just very important to protect yourself.
Oh,
from-
definitely.
From the
Definitely.
virus, to wear adequate clothing outside, even in the summer, hot summer months, when you go outside at nighttime, or when the mosquitoes are the most active.
Right,
Wear something to cover and protect your skin.
yeah, especially if you're gonna be near water as well.
Water or woods or timber.
Yes.
You mentioned the elderly are susceptible more than other age groups. How about infants?
Infants, well, last year, out of those 5 cases that I mentioned, one of them was not an infant, but one of them was a teenager. It was a young gal, I think she was 16, and she was the youngest here in DuPage that had West Nile, but apparently she had a heart problem, I believe it was, and that's why she died of West Nile, but she didn't even know, and her parents didn't even know that she had this heart condition. So, like I said, that's why it's hard to know until later on, once you're in the hospital.
I understand about the stagnant water, standing water. What about moving water in my fish pond? Do I have to be concerned?
Your pond at,
I have a fish pond, it's a filter system, the water is constantly being circulating and it's moving all the time.
well, if it's constantly circulating, I don't think it's water that just sits.
That doesn't sit.
Mm-mm. And yours is filtering, so I
Yeah.
think I believe you are fine with that. It's like water that's not doing anything.
Either that or train the fish to eat mosquito larvae.
Yeah, I mean, you know, there's people that have like old tires in their backyard, and you know, it rains and the water sits in the tire. Or even if you might have one of those swings that are tires, and you gotta be sure you empty that, because if your child or your grandchild is out there and hasn't been on that tire swing in a long time, there could be water in there, and the mosquitoes can also be in that tire as well.
And one of the ways that could be done easily for people, they wouldn't have to go out and just throw out those tires. They go out there with a drill and just put a few holes in the bottom of that tire to relieve that water.
Yeah, that's a very good tip. I didn't think of that one. I'll have to pass that one around as well. Yes,
How
ma'am.
about rain barrels? And I notice my water sits in there for a while before because with the rain, it fills
Everybody's got
out.
those rain barrels, they even
Yeah.
sell them now,
Is that a
where the
concern?
drains come down and but usually the good rain barrels aren't they sealed on top?
Yeah, I was just gonna say, they're
No,
covered.
they have like a grate on top, so the rain can go on it.
A real big one? See, the ones I've seen
It's
are.
not real big,
are-
but it's big enough for, I
But he's got
think,
lids on
mosquitoes
it.
to get through. It's not real, it's not tight, it's got a little space in there for the rain.
Well, that might be a little bit of a risk,
There might be.
something could get in there,
So I'm wondering,
depending on how large those holes are. But the ones that I've seen that they're coming out with now, they fix directly to the top of the thing. I think that's probably to address this issue.
Yeah,
And
they-
not have stagnant water, so if you have a situation with the rain barrel, you might wanna look and see if there's some sort of adaptive type top that you can run the water right into.
Yeah, I've seen several screens
Is this
on the top
draining out your
about
gutters?
yay big.
No.
They're small, but
It's by the
other
garden.
mosquitoes.
Right, that's true.
It's on a raise.
That's true. That's a good question, though. I'd have to get some more information. The
Okay,
ones
so
I know
hers
too
is,
were small.
hers is collecting, not the gutter water, hers is
Everything.
collecting rainwater.
Yeah.
So she wants it open, it's collecting rainwater and then she uses it to water the garden with. So-
Well, yeah, it depends how often do you move the water that's in there
Right.
too.
Well, every day,
Oh,
but it's a
Well,
huge
then-
barrel, it's big, so the water's not that much.
Yeah, but every day, if you're
Something
draining
comes
water
down.
out, it's moving, like she's
And you
saying,
get
the
more.
motion of the water is gonna kill the larvae or kill the eggs. They want setting water, very stagnant, very still water for them to survive. That's
Right.
kinda how that works.
so that would take a few days for that to happen. Okay. Through DuPage County and several parts of the county, we have nets that are placed throughout the county. And after every week, they go and they collect these nets with the mosquitoes in there. And through, at our lab at the health department, we have one in Wheaton, Westmont, Lombard, and Addison. We have different satellites. And then we have people from environmental health that go collect these nets with the mosquitoes, they bring them back to the lab, then they freeze them, and then they dump them on a table, and then we actually have people that go one by one, and they distinguish which is the Cuculus pipian mosquito and which is just a normal mosquito. And then they separate them, and then they put them in a machine, and they check to see if they come out positive for West Nile. So it's a process. It's something that we do every week. That's what DuPage County is doing to make sure that, we have something going on the southwest corner of DuPage County, we would know. Also, DuPage County on the website, we have a personal protection index. Every Wednesday, and today's Wednesday, at 3 o'clock, we will post the index level of West Nile, okay? 4 obviously is the highest number, 0 meaning there's no sign of West Nile. So every Wednesday, you can go to the website after 3 o'clock, and you can see where we are as far as levels of West Nile, okay? I believe today we are at a 2. And 2 is low, so continue draining, defend by using insect repellent containing DEET. That's the rule for the week. Yeah. But we are at 2 right now. After 3 o'clock today, they will change it or leave it the same. But that's something that you could look on. And like I said, there's also more information on the website if you're interested in more. I did bring another flyer out here, and this is, once again, pretty much what I talked about, but how does West Nile spread, what types of mosquitoes, it's a little bit narrowed down to the presentation that I gave you. So you be sure you take one of these as well. And our website is right here, in case you want to go and look us up and see what other information we have regarding West Nile. I did bring some packets of insect repellent. These are nice because you can put them in your purse, and if you happen to forget to bring the can, or something harder to carry around, but this your purse, guys and men, in your pocket. So you can take these as samples. They have about an 8-hour lasting.
Are they wipes? Is that
Yep.
how you apply them?
Yeah, they're wipes. And be sure, you know, with your grandkids, if you are applying West Nile virus, insect repellent to them, be sure that an adult is applying that to them, because kids, if they do it, they tend to put their hands in their mouths or their eyes, and you definitely don't want your grandkids to, you know, have that in their mouth or their eyes, okay? It's something maybe mom and dad, this information would be good for them. And we also have stuff for preschool and for young adults on our website, so you be sure to tell your families, your daughters and sons, that we have that available to them, how to protect their kids as well. Yes, sir?
The only way to get it is to be bitten by a mosquito. Is it transferable human to human?
No,
Or human to child, or
no,
it's
no.
just, you gotta get bit?
Gotta get bit. And there's only one kind that bites.
Yep. Who do you think it is that by one sex bites?
The female, of course.
That's right. The female mosquito is the only one that bites. The male mosquito does not bite. Does not
Acid, acid, non-aggressive. Are we getting this on tape, Al?
Okay.
Yes.
All right.
It is the female mosquito that passes the West Nile virus. I will have to say that. The males don't, okay? And the females are, I did see an actual male mosquito and a female, and it's interesting, the male mosquito has almost like a little mustache thing too. It's funny to see that. I was surprised, but that's how they showed me. But they have like little whiskers, so, yeah, and
Was he sitting in front of a television watching sports too?
No. But, and the West Nile, the Kuplex pipion one, it's a little bit on the red side. It has a red color. But like I said, you would really have to have a magnifying glass to really see the difference between a regular mosquito. If you have one, you know, sitting on your arm, you would, first of all, you'd have to, hopefully it wouldn't move to actually really get it that close to you to actually see if it was that type of mosquito. So, it's hard. Yes, sir?
Sugar Creek Golf Course has several ponds. They have water running through it. But there are several areas in the golf course where it seems like the water just stands. It gets a green algae on top of the water. Is that a breeding area for them?
It could be, but most areas, places that have ponds, the property management is connected with a company called Clark, and they are usually the ones that are coming out to deal with the pond and the mosquitoes and the water there.
And I believe the village does deal with Clark, is that right, Miss Anna? Yeah.
So it's something that the golf course would have to keep on track of that pond.
Okay, thank you.
About 60 years ago or so, when we first married, we were doing some property up at Chain of Lakes, which is near Baldwin, Michigan. And we built a cabin out there. It's 50-some years ago, if not 60 almost. And we were back in the woods. There weren't hardly any houses around us, just back in the woods. And we get a lot of mosquitoes at times. And the funny thing is, I could be next to her and they would ignore me and they would bite her. There's something about
Yes.
males or the smell of a man or a woman or whatever it is. The woman attracts them more than a man, I think.
Well, it's different. I think it's also, you know, what we eat also has something to do, you know, our pores breathe something else out. Some of us, different lotion we might wear a perfume or a cologne that's more smelly to a mosquito that might attract them. But I've seen that happen.
Yeah.
I myself, on the other end, pretty much don't attract mosquitoes, so I don't know why.
Another feature of mosquitoes,
She does.
another feature that I've seen too is it's almost like, and I'm not a professional at this, but I think they see heat. I think they see differently than we see, and you know, some people are more warm-blooded than others and things like that, and then they obviously are able to target in on what it is that they like best. So,
Yes. Yeah.
You know, unfortunately, you know, my wife gets colder than I do in the winter, and I get, you know, and that might have something to do with which one might look better to me.
Right, yeah, everybody's body's different, and our pores, you know, let out different smells, so, that's probably why it attracts different people. Like I said, myself, I usually don't get bit by mosquitoes.
As long as he stands alongside me, he don't get shit.
Because you're the one that's getting it.
I'm getting it.
He's smart.
If they ever find out what it is you rub on yourself to keep a mosquito away, then people will go out and buy it in droves.
Right.
Now.
But if it's a skunk, then I doubt anybody's gonna go out and buy it.
No, I know I'm not. Yes.
2 years ago, I had an ill bird in my yard. It was a robin, and it was acting very erratic. I took it to Willowbrook, and they said it had West Nile. And, you know, I would get in the car and take a bird anytime, but since then, I found out if you call Willowbrook, they've got volunteers. They'll come out and pick up a bird. And to have this bird that was flying erratic and not acting like it should be, you don't need another mosquito coming along and sucking its blood to pass the virus on
Right.
elsewhere.
Right. DuPage County used to collect dead birds, but we do not anymore. This is the first year where we're doing it a little bit different. We actually, on our webpage, there was just a news release saying that you can report dead birds online. So instead of somebody going and picking it up and bringing it in,
This one wasn't even dead. It was
Oh,
still
still
alive.
alive.
And
Oh.
it was still alive, right. 'Cause
so you can actually call, and the health department will take note of where you saw it, and they're gonna, this is the first year, so they're gonna keep a track to see, you know, if it's more of them are found in Lombard versus Westmont, different parts of the county. So this is a tool that we have now on the website. So if you've come across a dead bird, you can report it online to us.
And
So
how would we dispose of it then after we reported it?
you're not supposed to touch it.
No.
Well, I'm trying to see if I see, they say only birds that have, well, first of all, you would have to know if that bird has been there for 48 hours. I'd say. Okay, should it be reported if it's been dead less than 48 hours? And they're talking crows, blue jays, starling, robins, cardinals, sparrows, finches, hawks, and owls. These are the types of birds that are known to carry West Nile in this region. Okay, and once again, please don't touch the dead bird. Okay. I don't know if they're coming out to collect them, because I know they did last year, but not this year. They're just going by the data that you are putting.
Question, what if you don't have a website?
You don't, you can call us.
You can call.
You can call the health department. On the papers that I did give you, our phone number is on there.
Okay.
And you can ask for environmental health, and just tell them you have a dead bird and you want to know who you need to let that know to. And then we can take your information down and we put it on our data form. Okay. Any other question?
All righty.
Okay.
Well, thank you, Lisa, for coming out.
Thank you for having me.